Hi Third Floors, how do you do?
Hello, I am doing well. Thank you for asking.
Yes, I want to know about Evolution Management Department, which is having a high demand in medical coding field. Can you please explain me?
Sure, I'll explain you in detail about E&M in this session. An evaluation management means the identification of diseases and giving appropriate treatment to the patient. First of all, when patient visit the hospital with any illness, doctor will take the details from the patient regarding the problem, which we'll call as history. Once taken history from the patient, doctor will do the physical examination to know what exactly the problem is. After examination, he will decide which treatment will suit for the patient problem, which is nothing but management. This all together called as evaluation and management. In order to code for evaluation management, we had to check for the components. There are totally 7 components, which are nothing but history, physical examination, medical decision making, counseling, coordination of care, nature of presenting problem, and time. Within this, the first 3 will call as key components, and the remaining will call as contributing factors, which will be as supporting factors for the key components. Now we will see one by one about this component. First of all, history. History is obtain the complete details of the patient's current problem. Once done, doctor will do physical examination, which is nothing but examining all body systems in order to find out the exact problem. And coming from management, which we'll call as medical decision making, is giving proper treatment to the patient's problem. These 3 we'll call as key components. And the next component is counseling, which means educating the patient and family members regarding how to reduce the risk of current illness. And next component, coordination of care, is the discussion with other physicians regarding the patient problem to give the proper treatment. And the 6th component is nature of presenting problem, which is documenting the severity of the problem that present at the time of encounter. And the last component is time. It's total time spent with the patient. Sometimes we can consider time also as one of the key components under certain circumstances. We will discuss history in detail in this session. To take history, we need to check for 3 things, which is HPA, ROS, and PFSH. HP is nothing but history of present illness, ROS is review of systems, and PFSH is past family and social history. Now we will see HPA, which is nothing but history of present illness. It is nothing but the questions asked by the doctor with patient like what's the problem, why it happens, and so on. HPA can be obtained by 8 elements, which are nothing but location, quality, severity, timing, duration, context, modifying factor, and associated signs and symptoms. Now we will see what is location, which is anatomical site where the problem is. Example, abdomen pain. Here, abdomen will consider as a location. And next, quality, which is characteristics of the problem like sharp, dull, throbbing, or tingling, etc. For example, a patient having a sharp abdominal pain, here sharp will consider here as quality of the pain. And next, which is severity, its degree of the pain like mild, moderate, or severe, or sometimes will consider by means of pain scale. For example, a patient having moderate abdominal pain, here moderate will consider as a severity. And the next is time. Timing is when the problem starts, whether it starts in morning or evening or any specific time like 8 am, 6 pm, etc. For example, a patient having abdominal pain which starts at early in the morning, here early in the morning will consider as a time. And next, which is duration, means how long the patient is having the pain, like it may be a week or a month and so on. For example, if patient having abdominal pain for the last 2 days, here the 2 days will consider as duration. And the reason for the problem is nothing but context. For example, if patient got abdominal pain because of any food poisoning, here food poisoning will call as context. And what the patient done to the problem to reduce or alleviate, like he may be taken any tablets before going to hospital to reduce the pain. Here tablets will call as modifying factor. And the last, which is associated signs and symptoms, is other symptoms related to that problem like nausea, vomiting, muscle pain, etc. So, in order to take HPA, we had to check all these 8 elements. Now, we'll see with a sample. In this scenario, a 11-year-old male patient came to hospital for severe abdominal pain in right lower quadrant, which he developed early in the morning because of fight with brother and having nausea and vomiting. So we have to find out how many elements are present in this scenario. So in this scenario, we can take severe as a severity, abdominal pain in right lower quadrant as a location, and develop early in the morning we can take as a timing, and he got the pain because of fight with brother we can take as a context, and having nausea and vomiting will consider as an associated signs and symptoms. So altogether we have 5 elements from this scenario. So likewise we check for documentation to fetch all the HPA elements. Now moving to ORWAYS, which is nothing but a review of systems. The review of systems is an account of body systems obtained through a series of questions based upon the patient perspective. It includes 14 body systems which are constitutional, eyes, ENT, cardiovascular, respiratory, gastrointestinal, genitourinary, musculoskeletal, integumentary, neurological, psychiatric, endocrine, hematology and allergy. We have to check how many systems doctor reviewed out of this 14 systems. For example, in this sample you can see doctor did genitourinary symptoms like there is no dysuria, and musculoskeletal symptoms there is no joint pain, and neurological and lymphatic is negative, and coming for skin he has no rash. Likewise you check for documentation how many systems are reviewed for the patient. And next, which is PFSH, nothing but past, family and social history. So if you want to check for this, we have to check for 3 things, which is past history, family history and social history. Past medical history is nothing but review of past illness, operations or any injuries, which may include prior illness or injury, prior operations, prior hospitalization, current medication what patient is taking, or any allergies, age appropriate immunizations and feeding status. And coming for family history, a review of medical events in the patient's family, which may include information about the health status or cause of death of parents, siblings and their children. Diseases of family members which may be hereditary or place the patient at risk. And next, coming for social history, an age appropriate review of the patient's past and current activities, which may include significant information about marital status, current employment, occupational history and use of drugs like alcohol or tobacco, level of education, sexual history and other relevant social factors. So I check all these 3. Now we'll see in the scenario. So in this document, doctor mentioned past medical history as hypertension, osteoporosis and diabetes mellitus. And coming for social history, he is not a smoker and not a drinker. And coming for family history, and father had diabetes mellitus. Likewise, we have checked for the past family and social history. Now we'll see how this HPA, ORWAYS and PFH is divided into, because it's not possible always to take all this data from the patient. And coming for HPA, HPA is having 8 elements. It is divided into 2 parts. One is brief HPA and extended HPA. In order to take brief HPA, we required 1 to 3 elements out of this 8. And for extended, we required 4 or more elements out of this 8. And coming for ORWAYS having 14 systems, it is divided into pertinent. If doctor did only 1 system out of 14. And next, if doctor done 2 to 9 systems means we can take as extended ORWAYS. If doctor done 10 plus system means we'll take as a complete ORWAYS. And coming for PFSH, we check for 3 things and it's divided into 2 parts, which is pertinent and complete. For pertinent, we require any one of the past, family or social history, and for complete, we require 2 to 3. Next, coming to level of history. The level of history is divided into 4, which is problem focused, expander problem focused, detailed and comprehensive history. So this we can see in history table. In order to take problem focused history, the document should mention HbA as brief, ROI as none, and PFSH should be a none. That time we can take as a P of history. And if you want to take level of history as expanded problem focus history means the HbA should be brief, ROI should be pertinent, and PFS should be none. That time we can take as EPF. Likewise, if you want to take comprehensive history, the HbA should be extended, ROI should be complete, and PFS also should be a complete. This table is 3x3 rule. If the three components met, then only we can take the specific level of history. If not, it has to be downcode. So we'll see one of the example. If doctor did HbA extended, ROI is complete, and PFS is pertinent. In this case, the level of history is detailed because in order to take comprehensive, the PFS should be complete. As it is not met, we have to go for downcoding and we are taking history as detailed. We'll see one more example. If doctor did HbA as brief, ROI is extended, and PFS is complete. Here, the level of history is EPF because in order to take detailed or comprehensive, you require HbA as extended. But as it is not met, we have to go for downcoding as EPF. So like this, we have to check all the three things to take any level of history. We'll go with one more example. If doctor done HbA as extended and ROI is none and PFS is complete. So the level of history is problem focused because in order to take detailed history, you require ROI at least 2 to 9. As ROI is not met, we'll go for downcoding and we'll take history as a problem focus. For your better understanding, we'll see a sample chart. Here the chief complaint of the patient is laceration of leg. And coming for HbA, so patient was using a knife to cut a tree. During that he lacerated his left leg. He is ambulated to emergency department. So in this scenario we can take context as knife to cut a tree and location is left leg. So as HbA having two elements, we can take as a brief HbA. And coming for ROIs, as doctor did only one system reviewed, we can take ROIs as a pertinent. And coming for past medical history, is having a diabetes and the patient is married and living with his family. So we can take PFHS as a complaint. So based upon history table, we are taking level of history. As HbA is brief, ROI is pertinent, and PFHS is complete. So as per this HbA table, all 3x3 has to match. So we can take level of history as expanded problem focus history. So like this, you check for documentation to take the level of history. For your understanding, we'll see one more sample documentation. So in this case, we can see a female child who came to hospital for abdominal pain and she's having a diarrhea since this morning. So and because of this food poisoning, so we can take location as abdominal pain and food poisoning as context, and since this morning we can take as a timing, and she's having chest pain, so we can take signs and symptoms. So HbA having 4 elements, so we can take as extended HbA. And coming for review systems, that is GA as well as respiratory, and all other systems are reviewed. So if all systems are reviewed and negative, we can take as a complete. And coming for PFHS, so she is having a tonsils and adenoid surgery and she is a negative for smoking and drinking, so we can take as complete PFHS. As HbA is extended, ROI is complete, and PFS is complete, all 3x3 is met, so you can take as a comprehensive history. I hope you got a clear idea how to take the level of history.
Yes, I understood well. Can you please revise it again for better understanding?
Sure. So in this session, we've seen about history in evaluation management. So if you want to take history, we have checked for 3 things, which is HbA, ROIs, and PFSH. So what is HbA?
History of present illness.
ROIs?
Review of systems.
And what is PFSH?
Past, family and social history.
Super. So in order to take HbA, how many elements we have to check?
8 elements.
So what are the 8 elements?
Location, quality, severity, timing, duration, context, modifying factor and associated signs and symptoms.
Great. And ROIs having how many systems?
14 systems like gastrointestinal, GU and cardiovascular, like that.
And PFHs?
3 points like past history, family history and social history.
Super. So in order to take this one, you have to check all the 3. So as we can't able to take all the data, this HP is divided into how many parts?
2 parts, brief and extended.
And always divided into?
Pertinent, extended and complete.
Super. And PF is?
Pertinent and complete.
So all these three we have to club together and we have to see in the history table. So what do you check for history table?
We have to check for 3 of 3 or matching or not. If not, we can go for down coding.
Yes, exactly. Hope you got a clear idea about history in evaluation management. If you want to know more about physical examination and medical decision making, please visit our website thoughtflows.in and visit our nearby branches of ThoughtFlows. And ThoughtFlows designs various specialty training courses for experienced coders like you. The medical coders with multi-specialty skills will have more career opportunities. And what are the specialties we are providing means, which is nothing but emergency department, evaluation management, inpatient, general surgery, IVR coding, cardiovascular and thoracic surgeries, and anesthesia. Likewise, we have multiple specialties we are providing at ThoughtFlows. For more updates and videos on medical coding, please subscribe our channel and hit on the bell icon to get timely notifications.
Yes, this session was very informative and useful. For sure, I will like, share, comment and subscribe to your channel, and also I will ask my friends to do the same to get the more updates. Thank you so much and have a great day. Bye bye. Take care.